Asthenia is a medical condition characterized by muscle weakness, fatigue, or a significant decrease in energy. The term, asthenia, comes from the ancient Greek, meaning, without, and, stenos, meaning, strength, so literally asthenia means, without strength. Asthenia can occur as a single symptom or as a symptom in multiple medical conditions. Asthenia is a non-specific symptom that can occur in a variety of medical conditions, both mild and serious. In many cases, asthenia is reversible and can be resolved by addressing the underlying cause. However, in some cases, asthenia can become a chronic condition that affects a person's quality of life. There are several factors that can cause asthenia, including neurological disorders. Asthenia can occur as a result of neurological disorders, such as neuromuscular diseases e.g., myasthenia gravis, polymyositis, central nervous system disorders e.g., multiple sclerosis, stroke, or peripheral nerve disorders e.g., peripheral neuropathy. Endocrine disorders. Some endocrine disorders, such as hypothyroidism, lack of thyroid hormones, hypogonadism, lack of sex hormones, or Cushing's syndrome, excess cortisol hormones, can cause asthenia. Cardiovascular disorders. Asthenia can be a symptom of some cardiovascular disorders, such as heart failure, coronary artery disease, or arrhythmia. Musculoskeletal disorders. Some musculoskeletal conditions, such as osteoarthritis, rheumatoid arthritis, or fibromyalgia, can cause asthenia due to muscle pain and weakness. Psychiatric disorders. Asthenia can be a symptom in some psychiatric disorders, such as depression, anxiety, or sleep disorders. Systemic diseases. Some systemic diseases, such as diabetes mellitus, systemic lupus erythematosus, or chronic kidney disease, can cause asthenia as a symptom associated with the disease. Drug side effects. Some medications, such as sleeping pills, antidepressants, or blood pressure-lowering drugs, may cause asthenia as a side effect. Symptoms of asthenia may vary between individuals, but generally include muscle weakness. Asthenia is often characterized by muscle weakness that can interfere with a person's ability to perform physical activities that they would normally do without problems. Fatigue. Asthenia may be accompanied by an excessive and protracted feeling of fatigue, even after adequate rest. Decreased energy. Asthenia can leave a person feeling unenergized and lethargic, even in performing everyday tasks that are usually easy to do. Sleep disturbances. Some individuals with asthenia experience sleep disturbances, such as insomnia or poor sleep, which can affect their sleep quality. Inability to perform physical activities. Asthenia may hinder one's ability to participate in physical activities or sports, due to muscle weakness and excessive fatigue. Cognitive impairment. Some individuals with asthenia experience cognitive impairment, such as difficulty concentrating, remembering, or processing information. Mood changes. Asthenia can affect a person's mood, causing mood swings such as irritability, anxiety, or depression. Decreased work or school performance. Asthenia can affect one's performance at work or school, due to physical weakness and decreased energy. Decreased quality of life. Chronic asthenia can affect a person's overall quality of life, interfering with daily activities, social relationships, and general well-being. To diagnose asthenia, the doctor will conduct a thorough medical evaluation involving medical history, physical examination, and diagnostic tests according to the suspected cause. Treatment of asthenia will depend on the underlying cause. Some of the treatment approaches that may be used include treating the underlying disease. If asthenia is caused by a specific disease, such as neurological, endocrine, cardiovascular, or musculoskeletal disorders, treatment will aim to address the underlying disease. Lifestyle changes. Lifestyle modifications, such as setting a good sleep pattern, maintaining a healthy diet, participating in appropriate physical activities, and managing stress, can help reduce asthenia. Physical therapy or occupational therapy. Physical therapy or occupational therapy can help strengthen muscles, improve sleep, and help one adapt to asthenia in daily activities. Medications. In some cases, medications such as vitamin supplements, hormone medications, or anti-inflammatory drugs may be prescribed to manage asthenia. Psychological therapy. Psychological therapies, such as cognitive behavioral therapy or counseling, can help with mood swings, anxiety, or depression associated with asthenia. Holistic approach. Holistic approaches involving healthy lifestyle changes, stress management, regular exercise, relaxation therapy, and alternative approaches such as acupuncture or herbal remedies may also be used as part of asthenia treatment. Education and support. Education and support to individuals with asthenia and their families are essential in dealing with the physical, emotional, and social impacts of asthenia. Social support, counseling, or support groups can help reduce the impact of asthenia on quality of life. It is important to remember that asthenia treatment should be tailored to the underlying cause and should be done under the supervision of a competent physician. In addition, adopting a healthy lifestyle, managing stress, and maintaining good sleep patterns can help prevent or reduce the risk of asthenia. In some cases, asthenia can become a chronic condition that significantly affects one's quality of life. Therefore, it is important to seek adequate medical support and follow the treatment plan set by the doctor to effectively manage asthenia. In conclusion, asthenia is a medical condition characterized by muscle weakness, decreased energy, and decreased ability to perform physical and cognitive activities. Asthenia can be caused by various underlying causes, such as neurological, endocrine, cardiovascular, or musculoskeletal disorders. Treatment of asthenia depends on the underlying cause, and may involve treatment of the underlying disease, lifestyle changes, physical therapy or occupational therapy, medications, psychological therapies, holistic approaches, as well as support and education to individuals with asthenia and their families. Consult a doctor for proper diagnosis and treatment if you are experiencing symptoms of asthenia or a similar condition.